Subscribe to our YouTube channel and don't forget to press the bell icon to get all the latest updates. The last 24 hours have seen the single largest spike, more than 26,000 cases of coronavirus since the pandemic first broke. This data is now available to us at a time when several states are thinking of locking down again. Bihar has, Uttar Pradesh also has for a few days, and West Bengal is considering it. At the same time, major cities seem to believe that the worst is behind us, that we're looking at a plateauing out of the numbers. The lockdown may not be an answer to what India needs to do, but as India is now officially the third worst hit country in the world by the pandemic, and there are some alarming reports coming out of Johns Hopkins and MIT that are forecasting lakhs of cases per day by the winter of 2021 if we do not find a cure. Are we being complacent too soon? Are we, as The Economist famously said, tiring of a pandemic that is not yet tired of us? And that's someone's phone going off just as I'm about to introduce our very eminent panel. We have Kiran Shaw from Biocon joining us from Bangalore. We have Dr. Naresh Trehan from the Medanta group joining us. Dr. Naveen who runs Dang's Laboratories, one of the key testing laboratories, is with us. And Dr. Muffazal Lakdawala is joining us from Mumbai, who helms the much acclaimed NSCI Dome, a jumbo COVID facility and ICU center. I'll start with you, Kiran, because you have been advocating in favor of unlocking for a while. You've been arguing that till there's a vaccine, we have to live with this virus. But the fact is that Bangalore doctors are now sounding the alarm that the surge is not yet here, that the numbers could rise further. And what's really happening, I was interviewing one of the doctors, Dr. Taha Mateen. He was talking about a critical shortage of healthcare workers, of doctors not showing up to hospital, of doctors and nurses and intensivists and ward staff even not coming to work. Have we miscalculated? Are we not taking this data seriously enough? Is it just that there's such a fatigue factor that we don't want to look at this data anymore?
So, Barkha, it's very unfortunate that Bangalore and Karnataka, which actually was managing the COVID pandemic so well up until probably the early June, I would say, has suddenly found itself in a state of panic at the moment. Because we thought that, we were, well prepared. We had actually seen that all our hospitals were hardly being populated by patients, and everyone was very confident that we had actually learned how to manage the pandemic. But I think we started making big blunders early in June when we started reducing testing. When we started assuming that, everything was behind us because everything was only happening because of migrant labor, and that now that the labor has stopped sort of infiltrating into the state and that we put in some sealed borders, that we have nothing to worry about. But I think we were in for a very rude shock. Today, there is a sense of panic, there is a sense of pandemonium, there is a sense of not knowing what to do to contain the spread of the disease and the mortality rate, which is also very worrying. So I would say that now we are seeing the governments understand that they haven't really gone about it in the kind of planned, calibrated, measured way that they ought to have, because we were in a good state of preparedness. We were not overwhelmed. Our healthcare systems were not overwhelmed. We were doing a great job of testing, tracing, triaging, and treating, which was being done very well in the past. Today, all of a sudden, we are not doing all of this. The testing levels almost came down from a very large number of almost 10,000 tests a day to like less than 1,000 tests a day, which was crazy. You can't be doing that. At a time when you're unlocking, you should be testing more. And I think people also in our country have not understood that when you have dense populations packed in either slums or even apartment blocks which are very crowded, you need to test. You need to have some understanding of how you're going to manage all these kind of outbreaks.
So let me ask you, Kiran, before I open this up for the panel, do you believe, therefore, that there should be renewed restrictions I'm personally, after traveling for 3 months, not a fan of the lockdown. I think we wasted the lockdown. The lockdown was meant to actually do everything that we are now talking about, ramping up the testing, preparing the ICUs, getting enough doctors, right? Are you personally in favor of locking down again?
You know, it's not about locking down, but I think we had a very good strategy of containment. So the moment you had an outbreak, you were zoning and containing that particular area with buffer zones. They were doing it very well before the unlocking. They should be doing that. They should be, you know, look how Dharavi has managed to deal with this, the spread. So you do need to be very vigilant. I think we are not being vigilant. I think people are, you know, experimenting with various things which are not working. We need to simply go back to what worked.
Okay. Dr. Trehan, when Kiran makes the point about not enough testing, you know, I was looking through the data this morning and it's actually fascinating. For me, I think we wasted the lockdown and we wasted the most critical phase of the lockdown, which was the first 3 weeks. So here's what the data actually tells us. India is testing at 6,500 per million of its population. That puts our testing rate lower than countries like Turkey, Qatar, Switzerland. But what's even more staggering is that we have completed 10 million tests so far, but half of these tests were done after the 1st of June. So half of the 10 million tests that we have done were done after the 1st of June when India had already been in lockdown for 3 months. Do you think that we colossally underestimated this pandemic in the first couple of months of the lockdown?
So, Barkha, there are many factors to this, and let's not try to oversimplify it. The fact is that, in my opinion, and I think data also shows clearly, lockdown did help. It was supposed to help, and it gave us breathing time, elbow space to create enough of an infrastructure in the delivery system against COVID that we were better prepared as compared to when the lockdown started. Also, we knew that it is not going to stamp out the disease. We knew that it's going to delay the spike, which we were expecting. We predicted it. We all said it is going to happen at one point. And like to Kiran's point, people got complacent. I mean, I would see people, even doctors, appear on TV saying, you know how good we are, we contained it, we are so great. I mean, these are not kind of things that you don't know this enemy at all. You know you cannot let your guard down, not for now, not for another 6 months, maybe not even longer, maybe longer because we have to wait for the vaccine. So I think that this will run through our country, no question. Now, what are the facts about it? The facts are that a very large number of people are getting very mild symptoms. They are recovering quite well. The number of people on ventilators is actually very small. Our mortality rate also is lower than what it was maybe 6 weeks ago because we understand the disease better. The pathophysiology of the disease has been defined much better today than it was. So we always, it was only, it will go into your nasopharynx, it will go into your lungs, it will destroy your lungs and you'll die. Then thanks to these 50 autopsies done in Bergamo against the WHO advice, the Italians actually defined the whole damage done by our own system to fight the disease. So the cytokine storm, which we talked about, we didn't know what it does. So we know that it causes intravascular coagulopathy, which actually obstructs the oxygen transfer. So we know at every stage how to intervene. Now, the problem is, people still have not taken it seriously. If you look at, we always said the only defense we have today is that masking and distancing and hand. People still don't practice it. Now, if you don't practice it, you're going to bring it upon yourself. And we have such a large population. If we have 8 lakh people today, it's not surprised. It may be many more lakhs in days to come. So basically what I'm saying is, lockdown wherever necessary in containment zones for a period of week, 10 days, 2 weeks that you may need to contain those people. I think it's a very good idea. Lockdown per se nationally is not a great idea. I think we have to move out there. We have to be careful. We must keep hammering the people that they must do the precautions. So if that happens, we will be able to save many, many more lives. And the moment you get it, you please get in touch with a physician who can monitor you at home and tell you when to come to the hospital. Because I see every day now, I'm getting calls where people are now very short of, they come in here, they need 8 liters of oxygen. You know there's a lot of damage done already.
Okay, let me get Dr. Dang and Dr. Lakdawala now. Dr. Dang, when we were last talking on one of my programs, you said that there was such stigma attached to this pandemic that people of our class weren't showing up to test. Do you find any change in that? And in the middle, the governments, state governments and center have gone flip-flop on this, right? They started by giving you the license to test, then they did not want asymptomatic people tested. I don't know where it stands now. How many people show up every day at your labs to test?
Interesting, Rekha. Now, since we spoke last, there has been a change in scenario. One, that the number of people who are willing to get tested is more. But in Delhi, surprisingly, and as Dr. Trehan will also agree to what I'm going to say, the number of people who are testing positive has decreased in the last 1 week. I do not know if you're aware of it. I asked this question to my other colleagues from all the other major hospitals. The number of positivity as far as Delhi is concerned has gone down. But whatever is there, people are still being very injudicious, as Dr. Trehan mentioned. They're still getting the guards down. They're not realizing that it is not gone or not even battled out. It is because large number of patients are now getting the so-called rapid antigen test done. Since the time Delhi opened up the rapid antigen test, people's focus has shifted towards getting that test in the hospitals. And that's a hospital-based test. And the number of people asking for this test has gone up very high. I do not know how useful that test is going to be in the long run. Because as per you go and get a rapid antigen test done, we cannot do it because we're not a hospital-based lab. And the sanctity of the sample lasts for only about 1 hour or so. Once the sample is collected, it has to be processed immediately. It is a point of care test. If it is positive, the government is saying that it is positive 100%. If it is negative and you are having influenza-like illness kind of syndrome or disease, then go and get an RT-PCR done. Or if you're having no symptoms, then forget about it. The stigma which I think that has kind of decreased now because people have taken as part of their life, it just does not matter. Okay. And they know there are not so many people who are actually requiring admission. There are not too many people who are going on ventilators, but they still have to be extremely cautious. And now with the coming of the antibody tests also, there's again a new rush for getting the antibody test. But again, that's something we'll discuss maybe with the next question when I'll address the antibody issue on a different kind of.
Okay, I'll come to that. Dr. Lakdawala is someone who has set up and is running a jumbo facility, which has both isolation wards and a remotely monitored ICU. What do you do with the fact that no matter how much technology you use, how many gizmos you put up, if you're going to be short of nurses, doctors, and ward staff, and I know that you've battled with some of this yourself, there is going to be a problem going forward, because even if mortality rates come down, even if recovery rates go up, if infection rates continue to rise to the extent that people continue to need hospitalization, then we are going to run short. So why is Mumbai being premature in some ways celebrating the plateauing of its cases?
I think that anybody who would take this lightly, like Dr. Trehan said, would be foolish. Celebration is not around the corner. This is not some World Cup that we've won. Even if our numbers show a slight dip, I think it's because of the immense amount of hard work that has gone over the last 3 months. I do believe our numbers would go down, but the number of people needing critical care beds would go up. The only reason is because people are now doing home quarantine. They're treating themselves. Again, what he correctly said was that people don't know when to come out. So you have to be under a physician. You have to know when you need oxygen. You have to monitor yourself well enough so that you come at a time when we can save you. Right now, we are losing patients only because they come too late. They come at a point when it's already way beyond the finish line. So that sometimes it's just like you're just managing them just till they are eventually going to die. Irrespective of tocilizumab, irrespective of remdesivir, irrespective of plasma that we have. We don't have a cure, and that is something that we should be aware of. We were discussing initially about the lockdown. What I do believe, Barkha, is that the first step taken by the Prime Minister was a bold step. It was a necessary step. Yeah, we shut it down for a significant amount of time. We didn't do enough during that point of time. We do know that Mumbai and Delhi would be the most worstly affected because that had the maximum number of people coming from abroad. But the other states, like for example, Kiran spoke about Bangalore. I think we just didn't prepare ourselves well enough. We had a great window. We had almost 3 months to prepare ourselves. Let there be beds empty. There should have been enough of beds that were empty. But that is what we didn't do. We probably missed that critical period that we should have done a lot more and did very less during that period.
And before I take that to Kiran, how short are you even today, as beds empty up faster than they used to? How short are you of healthcare staff? This is the elephant in the room that almost nobody's ready to talk about. How short are you, Dr. Lakdawala, where you are at that NSCI Dome? Are you still short of staff?
In a pandemic, you'll always be short of staff. There are lots of reasons why you'll be short of staff. One is that the doctors probably are scared. Their families are scared. They're just not coming out. There are enough of people getting infected. There's a certain amount of people who are dying. And that all puts in fear. I think that we've ignored healthcare systems, especially government healthcare systems, for far too long. It's time to smell the coffee and wake up and realize that we can't always depend on private healthcare systems to bail us through. And a pandemic of this sort, you're always going to be short. However well prepared you are, you're going to be short.
Okay, now I think we all agree that till there's a vaccine, we can't be injudicious, we can't be careless. Kiran, there is an extraordinary letter written by the ICMR chief that promised a vaccine by the 15th of August. So there's the Oxford vaccine trial that does not commit a date. There is Adar Poonawala's Serum Institute, which is working with the Oxford vaccine trial, that is saying, okay, look, I'm pushing this into manufacturing, but I'm not putting definitive timelines because it all depends on the trials, right? Now the government comes forth and it clarifies that, the ICMR chief's letter was only meant to expedite processes, not get them caught in bureaucratic sort of red tape. Are you a bit dismayed at this kind of unscientific commitment coming from a body like the ICMR? I mean, how do you commit to a vaccine in 6 weeks?
Well, I think as they clarified in their letter, in their rejoinder, basically they said that we just wanted to give a sense of urgency and cut out the red tape, and that's why we made these statements. Of course, it is sending wrong signals to the world at large to even suggest that India would actually be, using a vaccine in 6 weeks for public use. But I think they did clarify, and in all fairness, I think we must understand that regulatory processes in India do take a long time. And we do know that to start any kind of trial in this country, it takes a long time. I think it was to basically get in a sense of urgency into the people who take these decisions. But leave that aside, Barkha. The point is, it is very important for us in the world to actually expedite the regulatory path for the vaccine. Mm-hmm. And I think that's what everyone around the world is doing. They're looking at basically doing a very structured phase 1, phase 2 study. And then I think they want to really compress the phase 3 timelines. And that's what the whole strategy is around vaccine makers all around the world. And I think that's a good strategy given the kind of situation we are all facing. So I think if we can basically get the phase 1, phase 2 trials done extremely well, where we actually look at the immune response, we look at the endurance of the immune response, and then basically take it into a very fast phase 3 clinical trial. And as you know, in phase 1, you do it in healthy volunteers. You want to then see you do a dose escalation. You don't even know whether you need 1 or 2 doses. And then in phase 2, you start, immunizing a slightly larger population. And in phase 3 is where you also have to start doing a challenge test where you actually take an outbreak zone and immunize some and don't immunize the others and see whether they get infected. So that's what takes time. But we do need to go through some of this to be able to quickly take it to the public. So I just think that it is going to take the better of the end of this till the end of this year. The fastest we can even hope for a vaccine is in early 2021. So that is how long we have to endure with this particular virus. And I, for one, believe, I just want to finish what I want to say, is that let us not be complacent. Let us manage this particular situation well. And I think we can do it, as both the doctors have said, that if you can get patients to come early enough, present themselves early enough, I think you can save many, many lives. I think what is happening today is that you're getting people coming very late, and then it becomes very difficult to rescue those patients.
I just had a follow-up before I take that to Naresh. And that was going to be do you feel that the regulatory process is as fast as it needs to be right now, Kiran? For somebody like you, who's also now, helping with, who's in the business of testing kits and so on, and in scientific research, are you getting your clearances as quickly as you need?
What I'm trying to tell you is that I'm privy to a lot of the vaccine programs around the world.
Yeah.
And I can see how they are going about developing those vaccines. I think we are trying to emulate those very fast-tracked systems. And I think, everyone's trying to do the best they can to ensure safety and efficacy. But, if you want to go about it strictly in the way vaccines are developed, it will, of course, going to take much longer. But It is about, generating real-world evidence as we go along, to really hope that we've actually struck upon a vaccine or two that will work well.
Okay, Dr. Trehan, I want you to talk a little bit about mathematical models. We started with a model from Ramanan Lakshmi Narayan that actually said if you don't lock down, there could be 2 million Indians dead by the end of July. That has certainly not happened. He also forecast 300 million infections by the end of July. That has not happened either. Now you have an MIT and a Johns Hopkins joint study that says minus a cure, India would see 2.87 lakh cases daily. I can't even process this number. I mean, if I have to start counting the zeros in it, I'd faint. 2.87 lakh cases daily by 2021 end, right? Should we be taking this seriously? Because I need to juxtapose it with another data point that while India's cases are rising, our recovery rate is at 60% compared to 27% in the USA. So you need to look at both figures, right? How seriously do you take these models, Naresh?
The beauty for statisticians and epidemiologists to go and come out with all this projection, when you ask them, they say, we project from certain amount of assumptions. If the assumptions change, then we are not correct. So many years ago, I read about somebody said, if you're going to predict something, predict it so far out that you're not alive to face whether it came true or not. Okay, not like Nostradamus. So I don't pay any attention to this nonsense, and we should not. We should not be looking at data and taking solace that we are doing so well. It's flattened out and it's not gone up. It's all nonsense. We know the enemy is there. It is invisible. It is affecting. There is not a single family which has no connection to somebody who's had it. Okay, Kiran said herself that they got misled by the initial data, which says we are doing so well, and then they let the guard down, and then there is a problem. Okay, so the lessons learned very clearly everywhere in the world. You try to get far ahead of yourself, you're going to suffer. So I'm in favor of unlocking, no question. I think more and more industries and offices and streams should open. Not the ones that have congregation of people. Very clear.
Schools, colleges. We've opened places of worship in this country and we haven't opened schools. Like, how does that even make sense?
So schools, there are certain rules. Like we opened airlines. I was in the consultative process. We said these are the steps you can take to keep people as safe as possible. Today, I think it's a month now since the airlines business started. I don't see any major reports which says that people got infected from the flight. Similarly, schools, I am in the favor that you should not take that decision today. You should wait till the end of July to see where things are going, in what region. These are shifting sands. Like you thought, North was the one, Western India and North were the ones who got it in the chin first. Now the South is getting it. Look at Tamil Nadu. same situation. What the reasons are, I don't know. But the fact is that maybe they celebrated too soon. Maybe.
Okay.
So I think go back to the same thing. You have only 3 defenses. There is no cure. Come to the hospital early if you are feeling, at least be under a physician supervision on telephone. I mean, home care. You get in time. We have now antivirals. We have anti-inflammatories. We have plasma. We have dexamethasone. So we have all along the 4 steps of COVID infection. We have something to give you. Something to try to protect you. So please do not shy away from coming and consulting a physician.
So Dr. Dang, I want to come to you on the antibodies, but I just want Dr. Lakdawala to add to that. You've been talking about oxygen banks. You've been talking about how what may need to happen is for oxygen to go to people rather than for people to go to the oxygen. Do we have to reimagine in a way how medicine and how doctors interact with patients?
So I think that what we've learned from the COVID crisis is that we've needed more oxygen than we've ever needed to treat any disease before. We went wrong in the early days of COVID, wherein we assumed it was like an ARDS, an adult respiratory distress syndrome. And so we treated it like that. Very, very soon we realized that what was correct was that they were just hypoxic. And we needed to treat them differently. For example, no ARDS patient was treated in a supine, like we treated them in a supine position. In these patients, we made them ulta. We actually proned them, and they did much better. Like Dr. Trehan said, the one thing that we learned from those autopsies was that there was coagulopathy. And the easiest thing and the cheapest thing that I used to save a lot of lives at NSCI was just an injection called a low molecular weight heparin. It was an anticoagulant and a blood thinner. And that has saved so many lives. We used X-rays with AI, and we predicted who would go bad. And so if you saw worsening in X-rays serially over we did it on the 4th day, 8th day, 10th day, and 14th day. If we saw a worsening of the X-rays, because we couldn't do CT scans in every one of them, and we didn't have ultrasounds at that point of time. So we did X-rays, and if someone's X-ray worsened, even before his saturations dropped, we put them on oxygen. Now, the conventional oxygen that we give in every ICU across the world, or probably even in India, was around 10 to 12 liters at best, all right? And in these, we needed high flow oxygen mask, which almost gave up to 60 liters of oxygen per minute. And that's what saved a lot of lives in the ICU. In fact, studies done in Europe, studies done in America, all have shown that the sooner you put a person on a ventilator, the more likely the chances are that you lose that patient. So management has changed. Like Dr. Trehan said, there are 3 cheap ways of saving a patient's life: oxygen, blood thinners, and probably a cheap steroid like a dexamethasone. Before, of course, we go on to the more expensive drugs like remdesivir and tocilizumab, which is only after you've got IL-6 levels and you can predict that you're already in a cytokine storm. So for the mass, let's use these 3 cheap ways of saving lives.
Okay, let me take that to Dr. Dang. Dr. Dang, before I come to what sort of treatments doctors are using, and a lot of this is, of course, experimental, you wanted to make the point about the antigens, people testing for antigens, people more willing to do that. When we first tried this, those tests were not found to be reliable. A lot of the testing kits were not found to be reliable. What are you finding now, and how is that changing the response of people to this disease? Because you said the stigma is lifting.
Barkha, I will start from the very beginning and first say that, of course, like all my other friends and panelists said, that we have understood the disease better now because of the autopsies which have been performed and our experience which we have gained over the last 3-4 months. Now, as far as testing is concerned, we started with RT-PCR, which still remains the gold standard. As for the knowledge of viewers who are going to watch this program, we all know that RT-PCR has got its own limitations. Though it has got a very high specificity, it has got a sensitivity of only about 67 to 70%. Number 2, it requires trained manpower, it requires a good infrastructure, and it is time consuming and labor intensive. And the tests take a couple of hours to come. On the other hand, when the government started the rapid antigen test, which I said before also, that it has again got its own limitations, that it can only be done point of care. And again, the specificity is better, but the sensitivity seems to be very, very poor. And again, with all the negatives, we are told that please go and get yourself again rechecked by RT-PCR. Coming to the antibodies part, The antibodies were again of two types. One are so-called rapid antibody test, and number two are lab-based antibody test. The rapid antibody tests, which were ordered a few weeks or months back by the government, were found to be not up to the mark, and so they were shelved immediately. I have no personal experience of having used the rapid antibody tests, but as far as whatever literature I know, whatever I've read, whatever I've heard, they were not up to the mark. Now we come to the lab-based antibody test. Lab-based antibody tests are again of quite a few different types. We can have a common total antibody test, which will give you both IgM and IgG antibodies. And number two, we have qualitative tests. We have semi-quantitative tests, and we have quantitative tests. Quantitative tests mean, but all of them require specialized equipment. But these equipment are there with most of the larger of the labs. For this, we require normal blood sample as taken for any other test. We look for the presence of IgG antibodies. And if you're doing a quantitative test, we can say that, okay, but your value of at the moment antibodies is say 110 or whatever it is. We can give a definite figure to it. Okay. Now, regarding this test, that is still very ambiguous. We do not know at this stage, because it's too early, whether antibodies which are taking up in positive patients, how long are they going to last? We're going to be there only for a few days, for a few weeks, for a few months, for a few years, a lifetime, we have no idea. Okay. If Kiran can put that, I'll be much obliged. But I don't think any one of us have any great idea.
So you're saying it's not a guarantee. You're saying as of now, to have had this infection once does not mean you can't get it again. It's like for example, you can get dengue 4 times, right? For example. So we don't know right now. We don't know. No
idea. Now, the accuracy of the lab-based antibody test is more than 90. More than 90.
Okay.
So they're accurate, the test.
Okay.
But
okay.
I can't say.
Okay, I need to start taking last comments. I know all of you have a busy day as well. Dr. Trehan, we haven't spoken about the WHO acknowledging the concern of scientists on this possibly being airborne. Now, in real terms, what does this mean? Because conventional knowledge has been, we sort of go out into open spaces, we're relatively better off. I go for a walk every day. I see people not using their masks at that point. Now, it being airborne, does that change anything?
No, yeah, that needs clarification, because airborne in a closed space where enough human breath or talking is being done, where those smaller globs come out, because first we thought only people who are in close proximity or people who cough can bring out a large amount of virus. But the controversy today, and it's not proven yet, is that if you're in a closed space, 100 people, and the air is circulating again and again, and there are 5 people infected in there, and they're talking for long periods of time, it's very possible that there is enough virus to go. Now, nobody has determined till today that how much viral load do you need to infect yourself. That is why we talked about surfaces. Yeah. Till today, there has been no evidence to say somebody got it from a surface. It has been cultured from the surface, definitely. Yeah. But what quantum of virus do you need to overwhelm your defense system? That has not been defined. But if you look at the experiment, where 2 people are within 3 feet in a contact of 15 minutes, one has COVID, one doesn't, then the chances of the person who doesn't getting it unprotected will be quite high.
Okay.
So the amount of virus coming out in that conversation, close conversation within 3 feet for 15 minutes is enough to overwhelm most people. Okay. So one person wears a mask who has got the infection, the other one doesn't. It comes down to low, medium risk. And if both of them are wearing masks and still less than 3 feet and 15 minutes, it becomes very little. So you know that there is a quantum of virus which is required to be able to overwhelm your system. So I don't think that you need to panic, but you must go through patient number 31 in South Korea. One lady attended 2 congregations, and when they traced back, they said that up to 50 to 60% of the infections in Korea were from this lady who was a super spreader who attended the church, and they were all singing and it all circulated and then infected it. So don't do any guesswork here. Just wear a mask and stay away. That's all.
Wear a mask and stay away. How long can you live like that? Dr. Lakdawala, briefly, because I want Kiran to close this for us. The amount of viral load, I know a lot of you who work on these jumbo facilities, the biggest challenge for you is what's called negative isolation, to create, kind of use virus burners to try and ensure that the air that's circulating in closed spaces like ICUs does not further infect people and health workers.
So I think the biggest challenge is always that you take fresh air in and you take infected air out. If it's in a closed space, then there are higher chances. So you have to use the air and treat it separately when you throw the air out. But if it's a very, very well ventilated area, then the chances are much, much less, because there is going to be cross ventilation that is taking the air away. I believe that social distancing still holds very, very vital. There are 3 or 4 ways that the virus will spread. One is by loud speaking, shouting. There's more droplets that time. By coughing, of coursingly, or by panting. So when you're running, and let's say you're in close proximity with somebody, because you're breathing very heavy, there's a higher chance of viral spread. So be careful, Barkha, when you're walking around, that might infect you without the mask.
Okay, Kiran, close this for us. The one piece of advice, you've already made the point that we kind of, especially in states like Karnataka, got complacent too soon. What's the one piece of advice for the government right now to not waste this period where the data, so we can't cherry pick the data, right? We can't believe the part of the data that says we're recovering fast, but not believe the part of the data that tells us our infections are rising. What's your final piece of counsel for the government?
So first and foremost, before I say that, Barkha, I must congratulate you for wearing this mask so effectively on all your various interviews. I really admire you.
But I'm very bad. I'm very bad. I only wear the normal cloth mask. I don't wear the N95 because I feel absolutely suffocated, but I do wear the other mask. I do wear that normal.
You have been wearing a mask and you've been brave enough to go and interview how many people across the length and breadth of the country. So congratulations. I really admire you. But coming to what the government must do, I think there are 3 things. One is like what I just mentioned earlier and Naresh said, that we must focus on very quickly containing outbreaks. We have to be vigilant. We have to see where is that next outbreak happening and seal that area, contain that area, and test everyone in that area as much as possible. Actually, I personally believe that you should be able to have a testing protocol that actually combines both RT-PCR tests as well as lab-based, ELISA-based or CLIA-based antibody tests. I think you should be able to do this because I think that is very, very effective in terms of doing large-scale testing, surveillance, and corroborating. And of course, pool testing is really the way to do it when you want to do this in large communities or zones. The other thing is, of course, you have to enforce mask wearing. I really think mask wearing is going to be so important for us to deal with this pandemic. And it really infuriates me when I go out and I see so many people not wearing masks. I don't even think they realize what's happening.
But I want to tell you, Kiran, from my travels across India, 23,000 kilometers, by the way, no one in rural India is wearing masks. No one. Nobody in the villages of India is wearing masks. So I don't know if this has to be police enforced, if it has to be mandatory. But at the moment, urban India is wearing masks. Rural India is not wearing masks.
You see, the thing is, it's only people who get infected and people who then lose, people they know, realize the gravity of this particular pandemic. There are too many people who feel it's not going to affect us. Or even if I get infected, it's going to be fine. I think that awareness, getting people to really, make sure that what Naresh just now said, right? He said that if one of you wears a mask and the other person is not infected and the one who's actually a carrier is wearing a mask, at least that cuts down the infection. If both of you are wearing a mask, it makes it even better. I think these kind of simple, logical understanding must be spread across the country because otherwise it's going to be very difficult to really deal with this pandemic. So my view is, please be vigilant, please track the outbreaks, and please make sure that you quickly contain, test, and triage and do all the things that are necessary. wearing of masks is going to be very, very important. And I really hope that patients actually come at an early stage of the disease to reduce the mortality. Because what we really need to do is to see a very low mortality rate and declining numbers in the mortality rate, which will really give us that confidence that we can cope with this disease. Right now, there is fear and pandemonium, there is this fear psychosis. And let me tell you, everyone who gets COVID is so scared to understand, am I going to make it? Am I going to live? Am I going to die? This is the paranoia and the psychosis that has come in. One of my colleagues has actually been tested positive, and he's measuring his, oxygen levels 3 times a day. And every time he's telling me, I said, listen, your viral load is so low and you're at home, and believe me, you'll be fine in a week's time. But he's so paranoid that every time he said, I hope nothing happens to me, because I just heard that somebody was fine and they collapsed overnight. Yeah. I said, it is not true. I think Naresh and Dr. Lakdawala, you can bear me out that when patients actually succumb, it takes some time before, this disease takes over. You can't just have nothing one day and die the next day. At least I don't think that's possible.
I mean, if you guys want to add to that quickly, I was going to close, but Naresh or Mufi, if you want to add to that, anyone? Naresh?
Yeah.
Do you want to add to Kiran's thing that we've got to remove the paranoia around testing positive? It should be, I mean, I'm not saying it's okay to test positive, but it isn't the end of the world for 85% people.
Okay, so you go through 3 stages. First stage is, I hope I don't get it.
Yeah.
Then you got it. Okay. Then you say, I hope I don't die from it. Okay. Then the whole stigma revolves around you. You say you don't want to tell anybody. You don't want to go get tested because somebody will come and put a red flag on your door, and your neighbors will throw you out. So all these things, I must say today, things are different because people are now getting used to the idea that people will have it and they will survive. The only thing that we don't know right now is how much of an idea is in their head that there is an essential that you get home care. Yeah. If you are on a home care program, you are 99% safe because the doctor and the nurse will be talking to you twice a day. And immediately they can pick up some of the symptoms that just to tell you, okay, come in and we'll check you out if you need to. Or you know what people are doing? They have bought oxygen cylinders, oxygen concentrator. You're at 8 liters. Now you're 8 liters, God damn it. You're on the threshold of going away, like Dr. Lakdawala said. They've crossed the finish line already. Now I have 4 patients come last night, relatives of friends of mine from 2 different cities, and they are now struggling in the ICU because of the fact that they came. Now their plasma, remdesivir, everything has been pumped into them. So that's the stage you don't want to get into. Please, first of all, wear a mask. Don't take it down while you're talking, because you see everywhere people wear it, but they want to talk to you, they take it down. The other is wear it below the nose. It's useless to wear it below the nose. So I think all of us, day and night, we need to drive that message home and scare people that you are going to get infected and there is a 5% chance you'll die. So just scare them that you better wear a mask, otherwise you're going to be in trouble. Let the media do it, let us do it, let the government do it, everybody do it. You can't enforce it. You can't arrest people. But you can put the fear of God in them. That's basically what we have to do.
Okay, we'll have to leave it there.
And by the way, recruit some sadhus and all that to go start spreading this message rather than saying come to the temple.
I thought recruit some sadhus to pretend that they have the cure for coronavirus. We'll have to leave it there. Dr. Trehan, Dr. Lakdawala, Dr. Dan, Kiran, pleasure as always. Thank you so much, all of you. Thank you.
Thank you.
Bye.
Well done.
Bye.